Okay. Good morning, class. Am I audible?
Yes, ma'am.
Okay. Let's start today's class. Today's topic will be on concept of IEC, BCC, principles of health promotion. So let's look into what is IEC, then BCC, then health promotion principles. Okay. So first about IEC. IEC, the full form is Information, Education and Communication. Okay. Information, education and communication. So the main aim is to generate the specific awareness to the target audience. And IEC is done for all the health programs, and in three stages it is done. First is by planning, then secondly by implementation, then evaluation. So giving an example, if we are to say about IEC of COVID-19, then we have to select our target audience. Okay, let's say our target audience is the community. Okay, the community people, the total population. So how will you give IEC? Is first you have to plan how many population, whether you are going to cover the whole district, whole state or the whole country, like that. Okay, you have to see, you have to plan it. So if it is a large population, like say suppose a whole district you are giving or a whole state you are giving, then which mode of communication will be better for them, like to reach to this large number of the population? One is like mass media, like radio, television, so that we can cover a large number of the population, right? Then you will give the information like wearing mask, social distancing. These are the ways to prevent the COVID-19. Like that, you will give the information, okay? Information, and then education, like you have to wash your hand properly, okay? And which area of the houses are prone to contamination and which need to be on and off. You have to clean it, how frequently you have to clean it. Like this you will give the education. And then communication means two ways method of interaction. Okay, so this is what is meant by information, education and communication. One example. So in any of the health programs, okay, in any of the health programs, IEC will definitely be there. So, okay, roll number 16, are you there? Okay, Rahel Sangma, are you there? Am I still audible?
Ma'am.
Okay, Rahel Sangma, you are there. So, can you name one health program?
Ma'am.
Any health program you have heard of? Even if you don't name the full program, you can tell a program is there for this disease, also you can tell. Any disease you know of where a health program is there. If you don't know, also it's okay. Just say you don't know. Any disease also you don't know? Any disease where a health program is there? Just the name of the disease.
Tuberculosis.
Yes, tuberculosis, there is a big program, National TB Elimination Program, NTEP. Okay, so TB, NTEP, we call it in short form. Then NVBDCP, okay, National Vector-Borne Disease Control Program, National Leprosy Eradication Program, okay, reproductive and child health programs. Okay, so many programs are there. So in any of this program, we will have to include this IEC. Okay, IEC means information, education and communication, but we want to convey to the community through that program. Okay, so it should be included in all the programs. So for example, like NVBDCP, National Vector-Borne Disease Control Program, what happens there is that, okay, NVBDCP program, this program covers about malaria, dengue, chikungunya, all those mosquito-borne diseases, okay. So what happens in this program is, through this IEC, we will convey the message to the community, like you have to, how to prevent from mosquito bite, okay, so that we can avoid the disease, all right. And then where can the mosquito breed, so that we will avoid this area where the mosquito will breed, okay. For example, Aedes mosquito will cause dengue. All of you must have heard of the disease dengue. So Aedes mosquito, what happens is that in their life cycle, they breed in the artificial collection of water. I'm just giving an example. So artificial collection of water, meaning that like at the back of the refrigerator, there is water collection, you must have known. So in our houses, we have these flower pots are there. In the flower pots, we have partly water collection, okay. Then there is old tires where there is water collection, and if we do not throw the dispo cup properly in the proper place, just throwing here and there, lying here and there. After rainfall, then a part of the water will be collected there in the dispo cup. Okay, so these are the favorable areas for the Aedes mosquito to breed. All right, but if through IEC, if we convey the message, if we educate the population that these are the area where the mosquito will breed, then we will tell them to avoid these areas, right? So, and another thing, we will say that weekly you clean your flower pot. Okay, once in a week you have to clean it properly, so that the mosquito larva, even if they breed there in one, they need 1 week as a life cycle for them to develop into a full adult mosquito. Okay, so if we clean it once in a week, what happens is that we have already destroyed their area where they can breed. Okay, so and then we can prevent ourselves from the diseases. This is one of the information we can give through IEC. So this information, how we will give to the population, we can give through mass media, one example, and then another one is through these banners and these flyers we have, okay, in areas. Even when we come through the OPD, we have so many banners, how to prevent COVID-19, what are the basic preventive measures we have, each and everyone has to take. Okay, so these are the information we are giving to the people. Okay, there are different ways of giving the information which we will learn later. So mentioning a few is I have already mentioned. So this is through those means of communication we will be giving this IEC. All right, next we will come to BCC. Okay, BCC stands for Behavior Change Communication. Behavior Change Communication. Okay, so let's first look what is behavior. So by behavior, it means an observable action of an individual, often in reaction to specific circumstances. So the observable action of an individual, we call it the behavior. Then change means modification of that particular action. Okay, and this modification will be in the direction, or it is intended to be in the form of an improvement, in the good way, in the positive way. Okay, the change will be in the positive way. Then lastly is the communication. Communication means two-way process of exchanging the ideas, okay, feelings or information. We call it communication. So what we have is an action will be there, and we want that action to be modified, or we want it to be changed in a way which will improve in the positive way through communication. Communication means of exchange of the ideas or the feelings or information. Okay, that is what is meant by behavior change communication. So this is the definition of behavior change communication, BCC. In short form, it is BCC. An interactive process with an individual or communities to develop tailored messages and approaches using a variety of communication channels to develop positive behaviors and to sustain or maintain individual, community, and societal behavior change. So this is the definition, but the idea is behavior is an action, observable action will be there. We want to modify it in the positive way through the communication, which is a two-way interaction of the ideas. Okay. Now, these are the stages of behavior change. Okay, there are many models how a behavior will change. So one of the most common model is this theoretical model. Okay, the name is theoretical model. So it starts from the bottom. Okay, the baseline, pre-contemplation, then contemplation, second, then thirdly preparation. Okay, action, maintenance, then relapse. So these are the steps of the behavior change communication. Okay, so here in pre-contemplation stage, what happens is that a person is unaware. Okay, the behavior what he is following, he is unaware whether it is he is in the denial state in this when he is in the pre-contemplation phase. Okay, so what happens is that if a person is there and he is a smoker, for example, he is a smoker, he is unaware that smoking is harmful for health. Okay, example. Or he is in the denial state that nothing will happen even if I smoke. Okay, that is in the pre-contemplation stage. The second stage is contemplation. Okay, in contemplation, what happens is that the person, to acknowledge that their behavior and choices may be causing problems. So now he is a little bit thinking like whether my behavior is good or not, whether it will be having any side effect or not, like that he started thinking, okay, at that time, at the contemplation stage. Then preparation. Individual possesses a growing confidence in the decision to change. Now he has decided. Preparation means he has prepared himself that he will stop smoking. Okay, not yet stop, but stop. He has decided that this is going to cause a lot of side effect, very harmful for the health. So let me stop smoking, like that. He has made up his mind. That time is called preparation. Then action. Make a commitment to a specific change plan and implement it. Now he has implemented it. Now whatever he has made up his mind, he has actually practiced it. Like I will stop smoking, and he has stopped smoking. Okay. And then maintenance. Maintenance means change really happens without some mistakes. So now I have maintained it for 2-3 weeks, then in a month or 2 months, like that I maintain the non-smoking phase. Okay, that is what is maintenance. So what happens is that when we go for a behavior change, we want it to be stopped at the maintenance phase. We want it to stop forever. Okay, in this fifth step. But at times what happens is that after maintaining that maintenance phase, at the maintenance phase for some time, and later at times some of the human beings, some of the persons, they tend to relapse, they tend to go back to their previous all bad behavior again. It does happen. So this is just a model. First is person is unaware. Second, that is the pre-contemplation. Contemplation is the person became aware of it. Then after being aware of it, what happens? Preparation. Okay, made up his mind to stop. Action means ultimately stop. Maintenance means maintain the good behavior. Okay, and at times there is chances of relapse also. So this is just one of the model. So another example is given here. This is the stages of changes. Pre-contemplation, doesn't mind. Okay, then contemplation. Okay, now he has started thinking, okay, if I exercise and all, then it will be good for health. He has started thinking. Preparation, now he has started preparing, made up his mind, okay, what to do. He has started thinking here, okay, let me start exercise. Then he has started preparing it, like how long to exercise, how frequently to exercise, what kind of exercise, at what time, like that he has started preparing it. Now he has started the action, implemented it. Okay, then he has started maintaining it. Okay, at times there is chances of relapse also. Okay, this is one of the example. So in any of the habits, any of the behavior, we can apply this stage of changes in the behavior change trans-theoretical model. Okay, so regarding the BCC objectives, what we have is if we are to give to the individual, particularly regarding the awareness part is important. Okay, towards the community as a whole, in the community, to a large number of the population, we mainly focus upon promoting preventive behavior. Okay, then service delivery. Okay, facilitating the adherence. Okay, then another one is the political level, that is creating the enabling environment. Okay, enabling environment. So here comes the difference between IEC and BCC. IEC is also giving the information regarding the good habits. Okay, BCC is also changing the behavior towards the good way. Okay, but the main difference is that in IEC, what happens is that, okay, what happens is that if I talk about this, if we go back to the same example of, say, malaria is caused by mosquito bite, Anopheles mosquito. So mosquito bite, so we will give to the community, we'll give the information to the community, it is caused by mosquito bite, so you try to sleep under the mosquito net. Okay, so when you sleep, like that we will be giving the information. All right, but we are not looking into the point like whether they are able to afford a mosquito net or not. Okay, whether they are able to buy the mosquito net or not, or else they have the mosquito net but they are not using it. Okay, at times it happens that because of the hot weather in other states, okay, like Assam, Tripura, they have the habit of sleeping without the mosquito net. It is because in summertime it is very hot. All right, so they have it, but they are not using it. And then those points we are not looking into in case of the IEC. We are just giving the information only. We are not looking into the point why they are not uh, following the good habits. Okay, so good behavior. So but in what happens in BCC is that we look into the point, why they are not following the behavior. Like that is what is not meant by this enabling environment. Okay, enabling environment. So what happens is that if we talk about the BCC objective, giving the example of malaria here, to the individual, we will give awareness. We will give awareness that malaria is caused by mosquito bite. You have to sleep under the mosquito net. You have to wear full sleeves. So at times full sleeves is not possible at all in case of the hot weather. Or you have to use mosquito repellents. Okay, and also you have to avoid those areas where the mosquitoes are breeding. Those kind of awareness generation you will give. Okay, in the community you will have the same thing, only preventive behavior like sleeping under mosquito net, then using the mosquito repellents. Okay, and then to kill the larva of this larva of these mosquitoes, then by biological method we have fishes like gambusia and all. So those kind of preventive behaviors we will be teaching to the community. Okay, then service delivery, like how I have told, like the larva of the this mosquito, it can be one method of controlling this larva of the mosquito is by the use of the gambusia fish. Okay, this is a biological method of controlling. So whether from where they will get this gambusia fish then. Okay, so facilitating the adherence, service delivery, and creating an enabling environment by the political level, at the governing level. So the government should think of, like, okay, we have already given the information that they should use this gambusia fish, but from where they will get, like that. So the government should give an enabling environment, meaning that they should make areas where the people can go and collect this gambusia fish, so that they can use this gambusia fish in near and around their houses. Okay, in any of the water bodies, like if they have a pond. Okay, so these areas, or if they have field also. Field is a very favorable area for the mosquito to breed, especially diseases like Japanese encephalitis. Okay, Culex mosquito, they breed in the field, the water which is collected in the field. We can't just remove the water there at that time, right? So we have to use gambusia fish. So from where they can collect the gambusia fish, like that we have to think into, and the government will make it available. Okay, that is what is meant by an enabling environment. So the main difference between IEC and BCC is that creating an enabling environment will be present in case of the BCC. Okay, that is the main important point. Okay, next, coming to the third point of today's class, that is health promotion. So we already have learned in la previous class also, health promotion, which level of prevention it falls into. Yes, roll number 17. Health promotion, which levels of prevention? 17, are you there? Yes, Mohit, are you there? Or anyone in the class? Health promotion, which level of prevention? Primordial, primary, secondary, tertiary, which level of prevention? Mohit Yadav, you are not there. Satyajit,
Yes, ma'am.
you are Mohit or Satyajit?
Satyajit.
Satyajit. Health promotion, which level of prevention is it?
Ma'am, primary prevention.
Yes, primordial. Good, correct. Primordial prevention, primary prevention, both includes this health promotion. Yes, mainly the primordial, correct. So in health promotion, what happens is that it enables the people to increase the control over their own health. Before the risk factor appears itself, we will promote the health. These are the good habits these are the good lifestyle, okay, they have to follow. So it covers a wide range of social and environmental intervention that are designed to benefit and protect the individual people's health and quality of life. So what happens in health promotion is that we focus upon the social and the environmental interventions also, right? Like drinking the properly treated water. We just, in India, what happens is that we do not recommend just directly drinking the water anywhere, right? The water which comes at home, the through the water pipe, what happens is that we filter it or we boil it. We follow some household level of purification of water, right? In India, I'm talking about in India. If in foreign countries, in developed countries, we directly drink the tap water. But in India, what happens is that we follow some preventive measures prior to drinking of water. That is one of the example, like we focus upon the social and the environmental interventions also. Then addressing and preventing the root causes of the ill health. So what are the causes of the ill health? We will address that, not just focusing on the treatment and cure. Okay, not just on the treatment and cure, but what are the causes, so that prior to the development of the risk factor, we will start the behaviors, good behaviors. So three key elements of health promotion are there. First is good governance for health. Okay, second is health literacy. Then third is healthy cities. Okay, first let's see this good governance of health. So we require policymakers across all the government departments to make the health a central line of government policy. Okay, we for following this health promotion, what we want, what we need in the first point is good governance. That is, we need the policy makers, okay, to prioritize policies that prevent people from becoming ill and protect them for injuries. So we have to prioritize those points which are causing the ill health to the people. Like, let's see the example here. We know that alcohol, tobacco, food products with high salt, like the fast food which we are having, okay, like salt, sugar, fat, like KFC, okay, Pizza Hut, Domino's, these are all causing what happens. These are all unhealthy and harmful products. They always have a side effect. So through the good governance, how we can promote the health is that, but that doesn't mean that tobacco products are no more available in the market, alcohols are no more available. This doesn't happen, okay. So what we can do is, through the good governance, what we can do is we will align tax policies. The tax charge is higher in this kind of food products where it is harmful to the health. That's why the taxes are high, okay, so that people will be a little hesitant while buying it. Tax is so high, so whether to buy or not, you will think, and you will reduce the times you will be buying the stuffs, okay, such kind of stuffs. Legislation that support the healthy urbanization by creating walkable cities, reducing the air and water pollution, enforcing the wearing of the seat belts and helmets. Okay, these are all health promotion measures which through the good governance. Like if we make a proper law that if you do not wear helmet while driving two-wheelers, you will be fined. This is an example of good governance of health promotion. Okay, so these are the points. And then area where smoking is not allowed, okay, smoke-free zone. These are the example of the good governance. Then next is health literacy. So people need to acquire the knowledge, the skills and information to make the healthy choices. So everyone should know it. What are the benefits, risk and the benefits of having this particular behavior or food or whatever they are following. So they should be acquiring the knowledge, for example, about the food they eat and healthcare services that they need. They should know about this all this point, like what the food they are eating is good or bad, what is the advantages of having this, what is the disadvantage of having that, and then they should make their own choices. They should be given the opportunity to make their own choices. Then healthy cities city play a very important role in promoting the good health. Strong leadership and commitment at the municipal level is essential to healthy urban planning and to build up the preventive measures in community and primary health care facilities. From healthy cities, we will go to healthy countries and then to a healthier world. So what happens is that in order to promote this health, promoting the health, what happens is to start from the grassroots level. That is what is meant by this slide, okay. It should start from the grassroots level, from the community, small community itself. It should start. So and then from the community to the bigger area, that is to the state, then to the whole country as a whole. Like that, it should start from the grassroots level, okay. Bottom to top, it should start. This is what is meant by this slide. Okay, so today's class was on IEC, Information Education Communication, then BCC, Behavior Change Communication. Everyone should know at least the full form. Then next is the principles of health promotion. Okay, so this is today's class. Okay, thank you.